was a difficult lecture because it's a sort of an overarching concept of MS therapy. And it's something that we do regularly in clinical practice, but then it's something that is supported by lots of evidence of different quality. One of the points that I did stress in my talk is that the quality of the evidence, we need to be aware of that. First thing, so we know something for sure, we know something probably, and there's things that we think we know, but we need to be aware that it's a bit uncertain. Okay, this is the first thing. Then when we move into the clinical arena, we need to take decisions, right? It's impossible that we have evidence and good evidence for everything we do. So many things we will do on an empirical basis. In terms of the questions that were posed in my talk, I think the first question, when we are all convinced that as early as possible, this is being shown by many papers, evidence coming from many places. Second, about which DMT, instead of which DMT, first is which strategy. I think the strategy of hitting hard and early, which is the treating with the highest efficacy as early as possible, compared to the escalation strategy, so use a low, moderate, and then escalate if there is a breakthrough disease. The first strategy, when you read all the literature, seems to go forward, seems to be better than the other one. But this doesn't mean that the escalation strategy is forbidden, because this is a general rule. Then in the end, when we go to the last question, in whom, because we need to personalize. Possibly personalizing of efficacy is just against prognosis. So the worse prognosis, the higher efficacy you need to make sure that you have fighting against the disease with the same energy that the disease is using to fight you. This is the first thing, but there are many other stuff around: safety, pregnancy, patient awareness, risk tolerance, and so on. So we need to be aware of all that stuff. We need to know the evidence, the level of the evidence, the quality of the evidence. We need to treat as much as possible, as early as possible, but then talk with the patient, make everybody aware of what we know and what would be our preferred position in that scenario, and then move forward.